Okay, welcome everyone. We are here for teaching, training, and communicating with those in science denial. And I will very excitedly and happily give a warm welcome to Gail Sinatra. If you'd like to tell us a little bit about yourself, Gail, please go ahead. Thanks for being with us.
Oh, it's a pleasure to be with you here today. I'm Gail Sinatra. I'm a professor in the Rossier School of Education here at USC. And I'm also joint appointed in the psychology department over in Dornsife. And in general, my areas of interest are learning in STEM areas, usually controversial areas or what the public perceives to be controversial areas. And we were working in the area of climate change pre-COVID. When we put this book together, my colleague, Barbara Hofer and I explored the topic of public understanding more in depth. We had worked together, done a few projects together, and that's how the book came about. And hopefully some of the insights in the book will be helpful to you, and we'll share those with you today.
Great, and I know many of you, so you know me too. I'm Catherine, and if you don't know each other yet, warm welcome. I lead the new Education Resource Center, the ERC, at our NIH-funded hub called SCCTSI, and we seek to optimize the way that we are leading educational offerings so that they can be more effective. We have more effective trainings because we are training the trainers and we're doing assessment. So if you are new with us, this workshop is held monthly, so please join us again every month for a different topic of interest and need. We'll get started. We'd like to get to know each other a little bit. You know, we have folks from Children's Hospital Los Angeles. We have those that are in the clinical and translational sciences. We also have those that train science teachers at all levels, and we have all types of educators. So we'd love for you to take a quick reflective moment, pause for a moment and think about an example of a time when your science message was well received. We're all communicators of different kinds of science messaging. And then when you're ready, you could share that in the chat, or if you prefer, open your mic and share it. All right, Karen, what do we have in the chat so far?
From Aileen, she says it was well received with folks who are good listeners and also have additional knowledge around the topic.
Thank you.
We also have Lenore, who says students receive social science research positively, generally. And another message here from Esteban. My message is well received when I teach workshops where everyone is there because they want to. That's a good point. And Elena says it was well received by people who trust my sources.
Excellent. Okay, particularly highlighting those last two, you know, we often make assumptions about our audiences for those that teach students, scholars, colleagues, community members, parents, and their beliefs. So we assume that we might be teaching to an audience that is supportive. And we also are probably not trained with psychology backgrounds for communication, whether it's science communication or not. And that's why we're here today. So we can see that it's important to apply the techniques we're going to learn today with Gail in order to update our own messaging. So we'll be able to describe common causes and effects of science denial that Gail will inform us of. We'll then identify opportunities for us to use Gail's strategies, research-based strategies in our science communications. And we'll share with each other our updates. We'll actually plan our next science communication using some of these strategies that are based in the research found in her book. So next we'll have Gail tell us a little bit more about the need for the research behind the book and some of the strategies today. Gail.
Thank you. So as I mentioned, this is my colleague, Barbara Hofer from Middlebury College in Vermont. And the two of us had done research in student learning about science topics for years together and independently. And we were invited to this conference about public understanding of science, and at that time wrote a couple of papers out of that event. And what we learned from that was we needed to do a longer treatment. And that's where we came to the idea that we should do a book. So in our book, what we do is we go through some of the psychological reasons that people not only deny, but doubt and resist. And you probably confront more doubters and resistors than straight up deniers in your work. So we talk about doubt, denial, and resistance from a psychological standpoint. And interestingly enough, we talk about many of the points you brought up in your chat just now. We talk about the nature of the prior knowledge they had. One of you said that if they have more prior knowledge, it goes better. That generally is true. You talk about that goes better when they're motivated to be there. So motivation is an important part of our book, and we talk about that a lot. And you said if they trust us or they trust the sources we're using, and we have a couple of chapters on those topics as well. So the kinds of things we talk about are the emotions, the motivations, and the cognitive biases that people have about science that lead them to doubt, resist, and deny. So some of these things we want to emphasize. Social media, as you're well aware, we all live, actually, not just some of us, but all of us live in these social media bubbles. So there, as you search for information online, there are algorithms that when you like a particular piece of information, you'll see more information like that. So people like to say, oh, they fell down a rabbit hole, but really what happens is people are pulled down a rabbit hole of information because they click on something they find interesting, maybe even intriguing or amusing. And before you know it, they're seeing more and more and more and more of that information. And so people really have a hard time separating fact from fiction. And I know I have shared a story that was incorrect recently, and it was funny because I had used all the right strategies that I advocate, and it had even been reported in reputable news sources and on television, major media and news sources, how everyone had shared it, and it was incorrect. So it happens to everyone, and we need to be aware that people believe these things to be true because they are seeing them as true, just as you are seeing things that are true, you believe to be true online as well. So we need to be sensitive to that context. K-12 science teaching is not optimal. Unfortunately, our teachers don't necessarily get a lot of science training. Elementary school teachers in particular are not super well prepared to teach science. One of the things that we're trying to do to improve that is employing something called the next generation science standards. Those are recommended standards for teaching science in K through 12. And what they do is suggest that you teach science more as a process rather than a collection of facts, because as we've seen so acutely with coronavirus, science is always changing. We just usually as citizens aren't watching that change occur in real time. And so it's been very jarring for people to see, oh, we need to wash your groceries. Oh, no, you don't. Oh, you don't need to wear a mask. Oh, yes, you do. That has been very struggling for people who view science as more fact-based rather than a process of discovery based on evidence. So we're trying to get teachers in K through 12 in this country to teach more of the process, which would be helpful. But for you, just to be aware that that's a misunderstanding that people have, that it's factual and it's fact-based. And so when science changes, you will see the resistance and the doubt. Also, having the right science communication training, your expertise is absolutely well-grounded in communication, but a key factor of that is knowing your audience. So that was brought up in your chat comments, knowing that they might have these misunderstandings about the nature of science, knowing that they may have doubt and resistance based on what they're reading in their social media, knowing that they may not trust a particular source that we might trust, like the CDC, knowing what their potential points of resistance are, misunderstandings, and perhaps negative attitudes and negative emotions like fear. Knowing all those things, I think, helps you understand your audience even better. We know that what individuals do when they do search for information online is they pretty much look to confirm their prior beliefs. So if someone hears, oh, the vaccine causes infertility, they'll probably go onto Google and they'll put in the words infertility and the vaccine. And of course, what will pop up is a lot of articles saying that is true. And as soon as they see the first couple articles that say that is true, then that's a confirmation bias, we call it in psychology, where it's just seeking out information to confirm their prior beliefs. And then they'll feel that, oh, I've done the research. I've looked online and I've found this. And so it is hard to shake someone off of that once they've confirmed their pre-existing belief. And so one important thing is to find out where people are getting their information. And unfortunately, this has become, as you're more than well aware, politically polarized, which is really unfortunate. And then finally, motivation and social identity. Someone mentioned in the chat, if they're motivated to be there, exactly going to be a better audience. But the kinds of motivated reasoning that people may use, which means they have a way to reason towards their desired answer and rather than the correct answer. Again, if they're searching online, if there's side effects to the vaccine and they're motivated to find that there are because you don't want to get it, that's similar to the confirmation bias. They will potentially seek out information and evaluate that information differently based on what they want the answer to be true, rather than what answer is true. And this is also wrapped up in their social identity, who they are. For example, this is not just true of one political ideation. People on both the left and the right, you get pushback, of course. You have in Southern California a lot of people interested in health and well-being who think that vaccinations are unnatural, toxic, or other things that they've read. And so you can get pushback based on identity. I eat organic. My neighbor told me, I don't need to get vaccinated, I eat organic. I'm a person who eats organic. So if you see your identity that way, and then you reason towards, well, if you're organic, you have a good immune system and you're healthy, you're all set. You don't need vaccination. So all of those things can be wrapped up in how they decide health decisions.
Okay, Gail, so let's see some of the strategies that we can use. What can science educators and communicators do? So Gail will take us through 3 of the strategies. We'll have the explanation and then we'll practice it so that we can change our upcoming science communication. So let's get into that first one. It surprised me because it involves empathy, Gail.
Absolutely. One of the sad things we see now in our polarized environment is people on both sides are pretty negative about people who have alternative views. You may have seen the Nicki Minaj tweet expressing some hesitancy regarding what she perceived to be an adverse reaction to someone she knew. If you saw that, you also saw how many people sort of, really dumped on her. And that's unfortunate, because really what you'd want to do with someone who said, hey, I heard this is a concern, you'd want to say, oh, really? Tell me about your concern. What is it you're worried about? Where did you find that out? Rather than, immediately contradicting that. An example would be, my niece was one of those young women who was concerned about getting the vaccine because she'd heard this about infertility. She's like 30 years old, wants to get married and have kids. So I said, oh, really? Well, geez, man, I have not heard that that's a problem at all. Like, maybe you should talk to your doctor. I understand why that makes you nervous, but talk to your doctor and find out, is there anything to that concern? And she did. She talked to her doctor, who did tell her there was no worry about it. She got vaccinated. And she also went to her friend who had shared on Facebook this misinformation, and she got her friend to get vaccinated. So it ended well. So how can you work on these points? One is to be empathetic and to focus your attention on the movable middle, we call it. Some of the people at the far extremes are not easy to shift, but as you've seen, there's just when people say, oh, there's no more persuadable people out there who would get vaccinated, well, more people get vaccinated. So I don't think it's true when we look at the extremes and we see some extremes, people quitting their jobs over having to get vaccinated. We think that's everybody out there, but I don't think that's true. I don't think the numbers say that's true. There's what we call the movable middle. There's people in the middle, like my niece, who have what they think are legitimate concerns and questions, and they just need answers. And those are the people you can definitely shift. One of the ways you can do that is by finding common ground or a common identity. An example would be my co-author was talking to a climate denier, and that conversation wasn't going great, as you might expect. And then she's older and so is he. And she said, do you have grandchildren? And he said, yes. And she said, I worry about my grandchildren's future and what's it going to be like with this shifting climate. And he admitted he was concerned about that too. And then they connected on this common identity of being grandparents, and things changed. They were able to make that connection. She also had a conversation with someone who was vaccine hesitant pre-COVID. She was hesitant to vaccinate her children. And she was a yoga instructor, and she was very much into, I eat organic, I'm healthy, and I'm not going to let anything come into my child that's not, organic. And she connected, this yoga instructor, with a woman who her kids played with, who had an immunocompromised child. And that woman said, hey, we this is our community. She was emphasizing the common identity of their community, and can you think about what this might do to my child? And they bonded on this community idea that she cared about her community and her play group. She got vaccinated. So it's helpful to figure out a common identity where you can get to a common ground, and that can diffuse some of the polarization once you make that connection.
Okay, let's do it. So for the first activity, we'll be together in small groups. For the other activities, we will be sharing as a large group. So you will be in breakout groups in a moment. And for one of your upcoming science communications, we'd like you to brainstorm together ideas that might make others concerned about it, practicing our empathy, putting ourselves in their shoes, wearing different hats. And then actually change your message. So for an upcoming message, try out a different version that you were not planning, that includes starting with empathy or starts by addressing their concerns that you've come up with, and see what kind of feedback you get from your colleagues in your small groups. So I'll stop screen sharing now, and we'll take about 10 minutes to do that in groups. I'll also pass the directions to you should you need them. So let me know. And then just before we go into these groups, if there are any questions about what we're about to do here in our groups, it would be a good time to ask how you're going to interact right now with your colleagues. Of course, you may need to introduce yourselves. Here come the instructions for the first activity we'll be doing. Those are in the chat. Again, you'll be thinking about your upcoming message and how people may react to it, and then changing that message so that you start with a phrase related to empathy. Okay. we don't have any questions, then we'll get started here. Here we go. See you in 10 minutes. Start recording again and bring up a few things I've heard, and also feel free to chat if you'd like to share or open your mics. But some interesting things I heard, Gail, was, would a written message, many provide a letter with sources in it, would that be as effective to convey empathy as one-on-one or, more personal message or a verbal message? And another one is, what if we don't share or know much about the cultural religious practices or reasons for someone that we're trying to have empathy, with? And then another one about exhaustion. We can't do it anymore. It's just too fatiguing to keep up this conversation. So what would you say?
I think you can have empathy through the written word. So I would say that's possible. I think it might be a little easier in person, but I do think it's possible. I mean, certainly, poetry conveys a lot of emotion, so written word can convey empathy. In terms of people's religious objections, obviously people do have some of that, and that should be respected. I think some people are claiming religious objections when they aren't really real. I know, for example, the Pope has come out pro-vaccinations, and yet American Catholics are still saying that it's a religious objection to not get vaccinated. So that's a little bit inconsistent. So yes, I know that there are some real faith-based reasons why people might choose not to get vaccinated, and that should be respected. But I think some people are just using that as an excuse. So a little bit hard to know, and obviously have to assume someone is being honest about it at first, and then maybe even don't know what their faith-based leaders have said. So you could at least share that. And then the exhaustion, oh man, I don't know what to tell you. You're on the front lines, and I wouldn't know what to tell you about exhaustion. I'm sure you're all exhausted. My nephew is an infectious disease doctor serving COVID patients, and he's got, people who had a woman's husband who was dying in his care, and she said, I want to go in the room, and he said she couldn't go in, and she said, oh, I can go in there. I don't believe in COVID. And he said, well, COVID believes in you, ma'am. So he wouldn't let her in, but he's dealing on a day-to-day basis with the resistance. He's had patients die, just told them, hey, I don't have COVID, I have lung cancer. And they've died in that belief. So it is difficult for all of the frontline workers, and like yourself. And I can't be anything other than empathetic with that.
Thank you, Gail. I'm going to share my screen again, and we're going to go on to learning and practicing the next strategy, which revolves around finding an in-group, which may not be our in-group. Right, Gail?
Right. How can we find a way to relate, right? So I'm sorry, I got distracted by your chat. Yeah, so how can we leverage a trusted in-group to help communicate your messages? So I think one of you told the story best, Esteban, that you were posting on Facebook that you are in the medical field and you got vaccinated, and one of your Facebook friends who was a bit hesitant went and got vaccinated. So that's, shifting who that in-group person is, that this person trusts, your trusted friend, and that might be a better person for them to trust than, Dr. Fauci, which, some people have certain authorities that they are more willing to trust. Religious leaders can be fabulous at this. For example, there's lots of faith-based groups that have offered vaccines after church, after services. And again, a trusted in-group member can help people to get vaccinated because they trust that person. I think in our communities of color where they have been underserved or misserved by medical establishment for unfortunately for pretty much forever, and are currently also experiencing medical inequities, those folks would clearly have some hesitance, and probably rightfully so. And so again, a member of that community would be a person that maybe could be a more trusted authority than your traditional authority. So it's finding the right messenger for a group, and it may not be who you think it is. It may be someone different, maybe a Facebook friend like Esteban is enough of an authority for certain people. So it's finding that right person.
Okay, so let's work on how we would find that right person. So for this one, we'll be thinking about it and then chatting, contributing to the chat. So we're thinking of an upcoming audience where we'll be presenting one of our science messages, and then thinking about those people's networks. So the folks in our audience, who are their epistemic authorities or their non-traditional authorities for them, not for us. And then what's our plan? How might we approach them? We're not used to interacting with them. So what would our technique or strategy be to approach them as communicators? So for an example, SECTSI, we work with promotoras. So these are our community members that are Spanish speaking, that are trained in delivering health messages to their own community. Okay, so take a few minutes to think about that and chat when you're ready. If you prefer to open your mic and share, please do that. And if you've already done this, or you frequently do this, you can tell us about a time when it worked really well, the epistemic authorities you selected. In the chat, you'll share 1 and 2, your audience, tell us your audience, and the message. What are you going to be talking about? And then who are your identified epistemic authorities?
And Joshua brought up a good point, is some people consider themselves to be the ultimate authority. Yeah, that's a real challenge, particularly when people have more confidence in their knowledge than is perhaps warranted. So that's a real challenge. It's hard to shake people off that, and it really depends on how they perceive their own expertise and where that expertise is.
Another contribution to the chat here we have is, what if, upcoming with the vaccine for children, the audience is parents? So who might be the epistemic authorities for those parents? Would it be other parents that could serve as authorities that they trust? Who do you think that would be?
I think it's a great idea to use parent groups, particularly parent, friend groups who know each other. An example would be, Esteban, I think this is your example, that to bring parents at school of those school kids so that, it's a community member, and talk about why they got vaccinated, not telling other people to get vaccinated, but just talking about why they were comfortable with it, why they did it, how's it changed their lives. Like I'm going to concerts now with other vaccinated people where you have to show a vaccine card, and it's like, yay, I get to go do that. So why did they do it? Why did they feel comfortable doing it? What has it afforded them to get more back to normal in their lives? And just to share those stories rather than to say, I did it, you should do it, just rather share their own stories.
And Lenore in the chat is talking about folks that have what's called social capital. So those could be elders in our community, well respected, not just celebrities that are more common to see. So we're thinking, what if I don't know parents, or I'm not a parent, or I don't know elders, or perhaps there's a language barrier and I can't speak with the elders. So how do we do number 3? How might we approach them as communicators of our messages?
I think for me, and I said this in the breakout thing, it's about being less prescriptive and just sharing and divorcing oneself from the outcome. So I guess in this day and age, the word influencer is bandied about. I don't see ourselves as needing to change opinions. People have to come to that realization themselves. All we can do is just lead them to the water. Whether they drink or not is a different matter. And so I think I come at it from that perspective.
I think that's a really good perspective, though, because I think if you take that approach, you're more an information provider and you're going to be more empathetic. If you're trying to persuade, you may feel sort of more pressure to sort of push people, which usually doesn't work. So I think your approach is a good one.
My only concern in that approach is how to simplify the numeric data for elder people or for normal average person. For example, if we say unvaccinated people are at 29 time risk of getting hospitalized.
So
Oh, interesting, because that's our next strategy.
Okay.
Go ahead, Brian. How do you do it before we go to the next one? How do you do it?
I mean, metaphors are really powerful. And so the moment you can grab onto a metaphor, and I use logs in a campfire as a metaphor, and someone who's taken a vaccine is the wet log who's not going to get burned by it. And that seems to resonate. And so I just try and find metaphors that seem to resonate with people and then just keep hitting hard on them. And that seems to work in some context.
Well, let's talk more about that with our next strategy. So it's not really maybe the sources or message we would choose or we would read, but it's what's most appropriate for our audience. Please go ahead, Gail.
Well, this is pretty much what Brian was just saying. You need to help people to find their own way. But unfortunately, there's a lot of misinformation online. So one of the things you can do is help people to find better information online. And that is to be teaching them the skills of fact checking, simple things like open up another window and open it up in incognito mode and then search again and see if you get a different set of information, which you pretty much will. Make sure that you look for the source, like who is the person that's provided this information. So teaching them just basics of fact checking sources, it's, reading information other places than Facebook. Sadly, most Americans today get their news from Facebook. This should be terrifying to everyone to hear this, because obviously that is, as we said earlier, filtered and based on an algorithm. So it's not necessarily good information. So, empowering people to become better fact checkers, telling them what are good sources of information, and helping them to figure out how to compare and contrast the information that they've read with other information.
I wanted to introduce somewhat of a question to that very fact about finding experts. One of the things that I've seen and it's come up in people's conversations with me is that there are a number of people that identify themselves and have the credentials to be in the medical and science community, and they've long since been discredited by their colleagues. That's a very hard message to get across to people, because they're not familiar with what discredits the scientists. Why isn't that person, if they're a brilliant biochemist, why could that person be wrong? That one's a harder one for me.
It is. I mean, look at Andrew Wakefield, who was a discredited scientist who falsified data linking autism with childhood vaccination. So many people still believe that person, even though he's been discredited. So one of the things we talk about in the book is, preponderance of evidence and not trusting a scientist, but trusting the consensus science. So I would tell people, don't trust one doctor. Don't trust even Dr. Fauci by himself. Don't trust an individual doctor you found online, because trusting the science is not about trusting an individual doctor. It's about trusting the consensus science. And so a good fact is that, I think you probably know the number better than me, but I know it's well over 90% of medical professionals have gotten vaccinated. So that shows you that the consensus of the community of doctors is that it's a safe vaccine. So rather than trusting a doctor, trust the consensus of a group?
It's sometimes difficult when you're having a conversation with somebody, you know, who's open-minded and reasonable. When they give you the argument that, yes, my auntie got vaccinated and then passed away. So you know, being in that space, you know, my knee-jerk response is, well, you know, what does the autopsy say? Or, you know, what other ailments did your auntie have? Because those can be contributing factors as well. But in that kind of a space, I think it's somewhat uncomfortable to begin to ask those kinds of questions, especially considering I'm not the primary care physician, to try and make a determination, especially if the primary care physician has not provided any clarity with regards to what the cause of death is. And so, you know, trying to understand their sources, I think this in this particular situation is somewhat difficult because here is somebody who has experienced, I guess, a death in the family, and it's hard to get them to think of alternative ways of trying to understand what transpired.
Oh, that's such a hard situation because you don't know the facts about this aunt's medical condition, and maybe the family member doesn't either. And so it's really a challenging situation. You know, I would just be respectful of that, you know, sorry for your loss, and then, you know, contextualize it to the broader death rates, you know, saying, you know, it's very unusual for people to die who are vaccinated, and other examples where it happens because they have conditions. Look at Colin Powell just this week, fully vaccinated but passed away. He had a number of health problems, Parkinson's and cancer that suppressed his immune system. So you can give an example of someone not in their family who was vaccinated and passed away, but contextualize it as to there may have been other reasons. And then also go back to, you know, their own health and say, you know, if you don't have any of these conditions, you know, the likelihood that you won't experience a negative reaction is very, very high. But again, you know, talk to your doctor about it. Maybe even talk to your doctor about what happened to your aunt, if your doctor knows anything about the case or if you have information about it, trying to separate them from this particular case. But yeah, I have to admit, that's a really challenging situation.
Time to lead with empathy.
Yeah, that's all you can do.
Gail, may I ask a question? What do you think of a strategy in that scenario wherein you remove yourself from that dire scenario and present an alternative which makes the same point? So, for example, you know, the analogous for me would be all of us wear seatbelts for the most part when we're driving, but unfortunately, some of us do get into accidents, and that could be because a seatbelt was faulty or something else completely unrelated to the seatbelt. Do you think strategies like those help, or do they detract because you're maybe minimizing the gravity of the situation in that particular situation?
I think that helps when it's not their aunt, but it's like, I heard of this person, you know, someone less close to them, you know, died from COVID. I think the strategy of what you just said is helpful to say, you know, seatbelts work most of the time. There's really rare cases where the seatbelt doesn't help in an accident, and sure, that happens. But I think when it's their family member, it's probably so sensitive that it's a little different.
We do have great contributions there to the chat to keep in mind as we move through our last practice. So we'll apply this, quite difficult. We're going to take a moment to search ourselves. We're going to search online for an upcoming scientific communication we have. We're going to identify a supporting source that's appropriate for our audience. So Rachel had mentioned they list these sources on the handout that's printed and given to patients. It'd be interesting to see one of those. So what you'll do is you'll put the link to that source in the chat, or cite that source for us in the chat. It'll also create for us a body of citations that we might be able to provide to others by you sharing. And then recommend a search strategy to your audience, your particular audience, to help them find their own good source, to go beyond your source and find another one. I would encourage you, if you're at USC or another university, to lean on your librarians for support. Our librarian faculty colleagues teach these skills, teach information literacy, search skills, looking for and evaluating sources all the time. So that could be an asset to you. So we'll take a moment here where you won't be paying attention to us because you'll be surfing online for a source to contribute to the chat. So take a minute to do that. Okay, we're starting to see some great contributions to the chat that you might like to peruse and use with your own audiences, as well as contributions for your folks to use themselves.
Yeah, I like this one from American College of Obstetrics and Gynecology. That's, you could talk to people about why you would find that to be a respectable source. So, who those people are, how those articles get vetted. CDC, of course. Yeah, Vaccinate LA, that's a good one. NIH, right? It's so interesting. People say, oh, you got to do your own research. But what do they mean by that? They generally mean they Googled it and watched a YouTube video. That's not doing research. I think it's important to remind people that's not doing research. You're not an immunologist. You're not doing research, to just Google something, but rather to do it with some intention like you're doing right now, with some critical evaluation, which thinking about who the sources are, why you might respect those sources. My nephew likes to say, you want to do your own research on infectious disease, go ahead and get a medical degree like I did. Get back to me in 6 to 8 years, then you can do your own research. But you really have to help people understand why, that's not research.
Please do continue to enjoy the chat and contribute to the chat as we move through our closing. So we're curious to know, how will your next science communication be different? Might it incorporate a strategy from our work today, from Gail's research, from Gail's book? I'll start off by sharing, and Deborah echoed this in the chat. We also know from our Center for Work and Family Life here at USC that empathy is so crucial. So if someone having an emotional response will need empathy first, because the scientific communication or bombarding them with evidence first won't get through when they're in an emotional response. So I'll have to start with empathy. How about you all?
Really good point.
Will it change anything else?
I like the chat I saw where someone said that they want to know that you care before they care about what you know. That's very, very true.
Yeah, thank you, Deborah, for that.
I think the comment about divorcing yourself from the outcome is really, really important, because you're a lot less invested in making your point and perseverating over the whole thing. I think that was really valuable.
Yeah, it makes it less threatening, makes it seem optional. Okay, so we'll be closing then by reviewing what our work that we've done today. So with Gail, we've described common causes and effects of science denial, some new and surprising, some not. We've identified opportunities to use Gail's research-based strategies in our upcoming science communications. Even if we already were using some of those strategies, perhaps we've learned a way to tweak them to be even more effective. And you've planned those updates by sharing them with us and with your colleagues and documenting them in the chat as well. So if you are interested in more, we do encourage you, and we'll send you these slides, to look at Gail's entire book to see even more strategies in more detail for a deeper dive. Right, this was sort of your buffet. If you'd like to go back for seconds, please do so.
And please feel free to reach out to me. You can find me at gsinatra@usc.edu if you have any follow-up questions in any way I could help you. Thank you for the work that you do. Best of luck.
And thank you for joining us today. And feel free to join us again next month and to contribute topics. You'll be receiving a survey from Karen. That'll be a follow-up survey, and you can indicate if you'd like future topics of interest or need. And of course, follow up with the Education Resource Center, with me, with Gail, and continue the great work in your science communications. Thank you so much.